Number 1. A psychiatric technician working in the clinic asks how the sulfonamides control an infection. What explanation would you give? The answer is, if a psy-tech working in the clinic gets asked how the sulfonamides control an infection, the explanation you should give is, sulfonamides inhibit the activity of folic acid in bacterial cell metabolism. Bacteria needs this to reproduce. Number 2. Antibiotics used to treat UTIs, ear infections and traveler's diarrhea? The answer is, the antibiotics to treat UTIs, ear infections, and traveler's diarrhea are both Septrin or Bactrim. Trimethoprim and sulfamethoxazole are two medications that have been used together. They treat bacterial infections including UTIs. They belong to a class of medications known as sulfonamide antibiotics. The antibiotics to treat UTIs, ear infections, and traveler's diarrhea are both Septrin or Bactrim. Number 3. What are some nursing interventions that are done when administering mefenide or silver sulfadiazine? The answer is, the nursing interventions that are done when administering mefenide or silver sulfadiazine are checking for allergies and pre-medicating with pain meds. Number 4a. What is a potentially painful problem of the urinary system that is associated with the use of the sulfonamides? The answer is, a potentially painful problem of the urinary system that is associated with the use of the sulfonamides is crystalluria. Crystalluria is crystals in urine. Number 4b. How can you prevent crystalluria? The answer is, you can prevent crystalluria by increasing fluid intake. You should increase it to 2,000 millimeters. This is around 8 to 10 glasses. Number 5a. What happens when a sulfonamide is given to a client taking oral hypoglycemic drugs? The answer is, what happens when a sulfonamide is given to a client taking oral hypoglycemic drugs is, it may increase hypoglycemic effects, resulting in lowering blood sugar. Number 5b. What should be monitored closely? The answer is, what should be monitored closely is blood sugar. Number 6. What are the instructions to give to a client taking sulfonamides? The answer is, the instructions to give to a client taking sulfonamides are, take with a full glass of water, take on an empty stomach, 1 hour or 2 hours PC, finish the full course of treatment possible, cover with hat, clothing and sunscreen for photosensitivity. Number 7. What are some side effects that a client receiving sulfonamides should be told to expect? The answer is, some side effects that a client receiving sulfonamides should be told to expect are photosensitivity, anorexia, Na lethargy, and HANA is an abbreviation for nausea, vomiting, and diarrhea, and HA is an abbreviation for a headache. Number 8. What are symptoms of Stevens-Johnson syndrome? The answer is, some symptoms of Stevens-Johnson syndrome are fever, cough, lesions on the skin, HA and muscle aches. Number 9. What are some instructions to give when a client is taking sulfasalazine or furidantin? Include those regarding skin reactions or color of urine. The answer is, when a client is taking sulfasalazine, it may turn skin and urine yellow. When a client is taking furidantin, urine turns brown. Number 10. What are some nursing principles to observe when taking care of second and third degree burns? Some nursing principles to observe when taking care of second and third degree burns are: monitor vital signs, take plenty of fluids plus high protein, use sterile technique, use of topical enzymes or antimicrobials like mefenide or silver sulfadiazine, and provide pain management like meds.